Hello, I'm Marcus Green. I'm the Chief Executive of Action on Preeclampsia, with a leading UK charity for women who have suffered with preeclampsia, and we are engaged in research, education and support for women. Now, I'm aware that you're watching this video because you have got some interest in the Giant Panda study, whether it's as a patient who has been asked to take part in it, or as a clinician who is thinking about introducing this trial into your centre. On behalf of Action on Preeclampsia, I want to say that this is an important trial which we are very, very pleased to endorse. The study is looking at two most commonly used medications, labetalol and nifedipine, to treat high blood pressure in pregnancy. Now, we know doctors choose one or the other, depending on the patient, as their preferred treatment. Now, this study is trying to find out which is the best at treating blood pressure in pregnant women without having side effects, which we know can happen. To put it into context, around 10% of women in the UK have high blood pressure in pregnancy, either as pregnancy hypertension or as preeclampsia. We also know that if it's not managed well, it can lead to serious complications for both the woman and her baby. Women have been at the centre of designing this study, absolutely integral right from the outset. Was part of the James Lind priority setting partnership a couple of years ago. This was something that we identified. We know that preventing severe hypertension is an absolute priority for women with pregnancy hypertension because it plays a significant role in whether she needs to be admitted to hospital, whether the baby whether the baby's birth might need to be brought forward, and critically preventing stroke and other complications. Preeclampsia is a very serious condition, so we endorse this. We know it's been funded by the NIHR, the National Institute for Health and Research. It's important and relevant research. It's going to provide useful information for women. It'll support clinicians to make decisions about treatment for pregnancy hypertension. It'll ensure that birth and pregnancy is as positive for women and babies as it can possibly be. This trial is run by an extremely able expert team. Professor Lucy Chappell is the chief investigator from King's College London, and it's been run in association with the Birmingham Clinical Trials Unit. It's a great study, it's an important study, and it's one that we wholeheartedly endorse. Thank you for your time. Please get involved.